Hi ladies, let's talk something a bit more up close and personal. Lots of women have lots of issues about their vaginal discharge. Some women think it's white periods and some women think it's actually a disease and they need to be treated. Actually, is that the true thing? Do women need to have this vaginal discharge and is it normal? If you look at our cycle, during the cycle, our body is preparing for childbirth or our body is preparing for fertilization. The first half of the cycle is what we call as a follicular phase. The phase at where the follicles, immature follicles are going to become matured little by little. During that phase, our body produces more of a watery, lighter, thinner, clear fluid, which is again the discharge that you get during that half of the cycle. More closer to the ovulation, the discharge becomes copious, more watery, more clear and more thin. This is to facilitate the sperm to go up. So when the sperm goes up, this becomes a very good media for the sperm to go up. On the second half of the cycle, assuming that the fertilization has happened, the body's discharge changes. So it becomes more of a thick, white discharge and the amount goes down as well, so that the whole environment becomes hostile for the sperm to penetrate. This discharge also facilitates lubrication for the vagina. This also helps with the moisturization of the vagina, and it also helps the vagina from infections and it becomes a barrier for the body. So all these little things are done by this natural vaginal discharges. Naturally, the discharges, as I said, are either copious, it can be white, it can be clear, it can be slimy, but it does not have an odor and it does not create any irritation or itchiness. This discharge can be little in some women, more in some women. Some women might not even feel that they have. So women have to understand there's a need for the vaginal discharge. Hence, that is why your body produces the discharge. There is no need for women to be looking for treatment for the normal vaginal discharges. Sometimes they can become abnormal where an infection can set in. So you can either have itchiness, change in color, change in odor, then that indicates that the normal vaginal discharge there is changed and there's an infection or inflammation going on in the vagina. Also, the discharge is changed according to your day-to-day habits as well. Some of the women will be using other stuff, chemical stuff to wash their vagina. Hence, there's a super added infection. And in some people, you can have copious discharges when things change, as if you have a cervical infection, you have a cervical polyp. All these can become excessive discharge. Those have to be looked after by a gynecologist. So naturally, women, yes, you will have some sort of a discharge all throughout your life, all throughout your cycles. But all the discharges are not a problem. They are physiological, normal discharges. If you like my video, do like them and do share them as well. If there are any questions, please do write them in the comments. I will answer them for you. Thank you.